I do believe that healthcare should be equal to all people. I get to work around about 8, and then I will deal with the immediate queries for the day. In the public sector, you're challenged every day, and then you have to find a solution. A lot of your time gets spent on trying to chase up orders, finding out where the challenges are, what is out of stock, what is alternatives, keeping in mind, because of financial constraints, how we can reduce costs.
And for allergy, you take one tablet at night.
In South Africa, the private sector services 16% of the population. The remaining 84% of the population is serviced by the public sector.
The moment to preach the chasms that divide us has come. The time to build is upon us.
In the late 90s, early 2000s, the private sector would send their prescriptions through to a central place, and there would be a data exchange and approval, and then that would be dispensed. Whilst the public sector worked off a totally manual system with no records, no governance. It was largely a chaotic environment that we inherited from the apartheid regime.
Every prescription was then handwritten. There was a lot of issues that came up with that. The more time you spend on a prescription, the less time you have to spend with the patient.
We also didn't have equity. So if you presented to a previous homeland, you would get a certain basket of medicines. But if you went to a previous white province facility, you would have an expanded basket of medicines.
RxSolution was developed back in 1997. It's a software, and it assisted pharmacists to really deal with stock management and dispensing in their pharmacies. It helps with the movement of queues. It means more people are able to be treated. And the stock inventory, of course, has also allowed them to keep stock of how much is left and so on.
If you don't have good supply of stock, you're in trouble, and you will compromise patient care. The system has really taken us to another level in preventing that type of thing. RxSolution has allowed us to capture a lot of information. Now we go directly onto the system, and we can pull up a file, and we can see exactly who dispensed it, when it was dispensed. So we've got a lot of data that we can work with to plan and strategize.
It's grown to an extent where it's now been adopted officially by government as the system to be used in all their facilities in the public sector.
Okay. And this is the cream. Now is...
I'm starting coming to this pharmacy last year in November to collect my grandchild medications. It's 9 months now.
And then that was the Bakaba, 4 ml twice a day.
Mm-hmm.
How is his mother?
She's passed away. She had October last year. Mm-hmm.
One of the reasons why I personally got involved in the development of RxSolution was to improve equity and make sure that whether you present in Cape Town or the Eastern Cape in East London or Aduchwa or Butterworth, you get the same package of care.
From the time that I started in public sector till now, there's been a huge shift to quality care. I've seen it taking place. I know we've got a long way to go, but I think we are moving in the right direction.
I will continue to entertain the hope that there has emerged a cadre of leaders which will not allow that any should be denied their freedom, as we were, that any should be condemned to go hungry, as we were, that any should be stripped of their human dignity, as we were.